not being enough, not looking a certain way, not feeling a certain way. The big appearance change that slows down, like getting this taken off the list, so to speak, like you were describing. And there's obviously resource constraints, travel constraints. If you're coming to see me in Austin, Texas, there's all sorts of things that crop up. So one of the things I'll talk about is simultaneous fat transfer for patients who are undergoing explant surgery, and like how to think about that. So fat transfers, and we'll try to approach it very, very clear so everybody understands. Everybody should understand like their body fat, their lean body mass, relative to bone density and everything. So with like a DEXA scan or in-body scan or something to help them understand their body mass index and proportion that they have of muscle mass to fat. And so that's my baseline. Like when you come in and you want to have an explant and discuss a fat transfer, we need to understand where you're starting with from in terms of lean body mass, because I've done several thousand fat transfers. I know where to go get the fat. I have tons of experience doing that. All the instrumentation that is the best in class. What changes, Dr. Moore, is the patient in front of me. One, do they have enough fat? Are they healthy enough? Are they free from mold? Are they, eating a proper diet? Are they not taking a GLP-1? Because everybody's now taking a GLP-1 to make my life more miserable, basically, to not make my life more miserable. That's a bit too far. To try to lower their inflammation, they're microdosing, which is not a thing, as you know. There is no such thing as microdosing. There's dosing, and then there's taking things and trying to see what happens. So basically what I do is I get them prepared a particular way to then execute the steps of the procedure. And then when we recover them, our goal is to keep them on the appropriate macros, but keep their BMI like it was pre-op or slightly above. Because if it drops even a single point below, you can lose as much as 40 to 50 to 60% of the fat.
Wow.
And that's really the game right there.
I think that alone, that statement, I've never heard. And I've talked to a lot of women that have gone to a lot of docs. And just making sure someone understands that so they have a point to just reference is amazing.
Well, first of all, I don't ever, try to oversell, overpromise, over anything, anybody. I just want you to understand, like, this is the best available information. You have to make the best informed decision. So for somebody in my position to say fat transfers don't work is total bullshit. Of course they work. Fat's the original filler. Mm-hmm. So it's your own genetic material. Of course it should work, given these sets of, we'll just say criteria. Like, we want the patient to be in good health. So your patient that you worked on and got all the symptoms resolved, except for some of the autoimmune symptoms. We would talk to her and say, look, given your current state of health and your toxicity report, because we use Vibrant Wellness all the time, as you know, this is what we recommend. And we can do this, meaning a fat transfer at the same time, or we'll delay it based on, our interpretation of your results and how you're doing from a health standpoint. And, I didn't mention hormonal balance.